off to Gord for some opening remarks and then updates from the previous meeting.
Thank you, Mr. Chair. We're going to just at the start tonight go through a couple slides of comparators of other municipalities. And when I go through this, you know, every municipality is different. They all have different needs. They all have different geographies and are facing different issues. So, you know, but in general, we all provide the same services in general to our citizens, and it's not surprisingly in an inflation year and with the cost of infrastructure that we're all approximately the same in our budgets as well. There we go. So at the top of the screen here is a couple that have gotten to the finish line and are approved. The first two are single-tier municipalities like us, Norfolk and Guelph, at 5.7% and 4.5%. Essex County has approved a 3.8%, but as I sent an email to council last week how Essex and Windsor often do their budget, announce their budget increase with also blending it with the education rate increases, which this year from the province is 0%. So they're really about, I would say, between 15 to 20% higher than these amounts. So Essex County at 3.8 and Windsor at 4.6. You can add about 15 to 20% to that. London is at 3.1%, but there's an asterisk there as well because what London did 3 years ago, they approved a 4-year multi-year budget of 3.9% average over the 4 years, but it was always, there was larger increases in a couple of the earlier years with a planned decrease in this last year to average that 3.9% in their multi-year approval. So yes, it's lower, but that's been the plan all along to be lower, and they'll be going with their next multi-year budget for 2024, and that's where they'll be. I know by talking personally to the treasurer, there's a ton of issues there that will have to be dealt with in their 2024 multi-year budget. Greater Sudbury at 3.7, Thunder Bay at 5.6, and Toronto at 5.5. And I got one more slide here. Oxford County, I'm not sure who the current CEO there is, but they came in at 6.3%. It's been approved. And then we have the rest are just their current positions. These are upper tier municipalities, so this would be blended with whatever the lower tiers come in at, but Brant County at 10.8, Region of Waterloo 8.6, Huron County 12.5, Perth County 7.7, and the three at the bottom, and I put them in there because they're around us, Elgin, Middlesex, and Lambton, they haven't released their draft budgets yet. They're looking to release it in the next week or two and have their debates running into March. So a quarter of the year will be over before they actually approve their budget for the year. So those are just examples. I tried to get mainly items this side of the GTHA and what was publicly available. Unless there's any questions, I can move over to Steve.
I don't see any questions yet. Oh, Councillor McGregor.
Yes, Gord, just for the benefit of those that might be listening, could you just explain to them what the effect is when you add like a lower or an upper tier to the single tier, how that often affects the budget? Because it's, you know, we saw the one on the first page at what was it, 3.8, but that's an upper tier and they still have to combine. So if you could just explain what that effect happens when those get combined.
Yeah, so upper tier deals with some of the main arterial roads through the municipalities, and then most of what would be our community health services, April's area, So if there's a senior's home, social services, often the library is at the upper tier, and land ambulance services are at the upper tier, where the lower tier looks after the parks and recreation, some of the more the residential roads, and usually the fire service is at the lower tier as well. So when they're so one might pass, the upper tier might pass a 4% increase, and the lower tier pass a 6% increase, but they're not added together. It's part of your tax bill is that for the county rate, and part of your tax bill is for the lower tier rate, and they're averaged together, but they'll be weighted to whatever the services are in that particular county. So.
No, thank you, and I just wanted that kind of explained, so when everybody's looking at, oh, they passed a 3.1%, that doesn't necessarily mean that that's going to be the final balance of what is actually paid compared to when we're doing a single tier budget. Thanks.
Correct, thanks.
Thanks, Mr. Budget Chair. So tonight we'll be starting on the operating budget. Council, in front of you, you do have the business case summary. So this was provided to each council member in order to be able to assist in determining which items have a net impact on the budget, and also as a quick summary on where to go to for each page. So tonight we will be starting within the budget book, and we'll be going through as discussed last Thursday, where we'll be highlighting each of the divisions that have a change request. But hopefully for your benefit, council, you can follow on the spreadsheet that does have the net tax impact. And I'll turn it back over to the budget chair.
Thank you. And just before we get to motions, we're going to go through our deputations. So we have one in person, and that's Robert Clark.
Good evening. Mayor Caniff, Budget Chair McGregor, members of council. My name is Robert Clark, and I'm the chair of the Chatham-Kent Public Library Board. And we, as always, appreciate your support of the library and your careful consideration of our budget requests. I'm here tonight because there may be one issue within the budget submission about which you will have some significant questions. While it may, in times of fiscal restraint, seem counterintuitive to reduce revenue in a budget request, this year the Chatham-Kent Public Library is requesting that $8,000, which is actually less than 1/4 of our budget, but we're requesting that $8,000 be removed from our request in order that we can eliminate fines for materials lent to teens and young adults. There are several reasons for this request. The elimination of fines to teens will reduce barriers to access. Increasing access to library services is a critical strategic goal of the Library Board and the administration. As noted in the business case provided, reducing economic barriers of fines on overdue materials ensures equal access to library services, no matter a person's income or age. Young people in our community utilize the library for many reasons: education, access to technology, recreation, and for personal interests and development. CKPL has identified in its business case that by eliminating fines for teens, we are anticipating an increase in young adult cards of 10% and a correlating increase in circulation of young adult materials by 10%. In 2020, Council approved removing $16,000 in fines from CKPL's overdue revenue related to all children's materials. The result was an increase in summer reading club registrations between 2020 and 2022 of over 1,000 children. As well, in 2022, almost 35,000 materials were circulated over the months of July and August. Similarly, we saw a significant increase in children's card holders, with the creation of over 700 new cards during the same period. The team at the library would like to build on that success with the elimination of fines on teen materials. Teens face many of the same challenges as children when accessing services at the library. They are often reliant on friends and family to get them to their local branch. Working within the existing staffing budget, CKPL has realigned positions to dedicate a staff member for teen services in all 11 locations. This individual has been tasked to select and promote the collection, develop and deliver programs of interest to teens, and conduct outreach at Chatham-Kent high schools to promote library services and create library cards for students. The fines-free movement has been a major trend across North America over the last 5 years. Both large urban and rural library systems are reducing and eliminating fines across all ages to prioritize access, improve community member relationships with library staff, to reduce the amount of time staff spend on collecting and processing fines, and to ensure that everyone has full access to their local library. Library systems close to Chatham-Kent that already have eliminated fines include Elgin County, Oxford County, Lambton County, and London Public Library. While fines have been eliminated for these systems, patrons who lose material or return them in a damaged condition are still required to pay replacement charges. In the development of the next 4-year budget, CKPL will also propose the elimination of overdue fines for the remaining Chatham-Kent residents, starting with our seniors. We truly appreciate your consideration of this item and indeed our entire budget request, which we have prepared congruent with both the needs of our residents and the overall fiscal situation. Thank you for your time.
Thank you. And we have 2 deputations that were submitted prior to the meeting, and we'll have Ryan read those.
Thank you. The first deputation was submitted by Harry Bradley. Good day. I'd like to begin expressing my deep concern in learning of a proposed 6.35% tax hike. This increase, in my opinion, is excessive, and I sincerely hope the Budget Committee, CK Administration, and the current Council can demonstrate effective leadership by reducing this hike. I've worked in government at the federal level for 36 years. During this tenure, I have worked through periods of budget cuts, wage freezes, and several periods of austerity. During these periods, I cannot recall in recent history CK ever having a 0% tax increase, while other municipalities and jurisdictions have. It seems our local administration and councils of the past are comfortable with simply putting the increases on the backs of the taxpayers without having to make the really tough choices. I believe this mentality needs to change moving forward. An opportunity to demonstrate effective leadership is available now, and it is time to seize it. In the CK Plan 2035, economic prosperity is one area of strategic focus. Economic prosperity is dampened when tax increases are imposed. Citizens have less disposable income to support local businesses. Small businesses, in turn, feel the impact. Let's keep this in mind during budget deliberations. A guiding principle in the CK Plan is open and transparent government. I'd like to offer that efficient government could also be included in this principle. In November 2020, a revenue-neutral proposal to modernize and reduce tax rates with a focus on area charges was presented to Council. Background information in this proposal noted there are 3,000 tax rates with 14 different area charges. The tax proposal sought to reduce 3 of the area charges administered and thus simplify the exercise of tax collection. This would of course support making the exercise of tax collection more efficient and in turn support the CK Plan 2035 guiding principle of open and transparent government. The 3 area ratings proposed for elimination were policing, streetlights, and horticulture. Only horticulture was approved by council for elimination, and it's worthy to note that this change had minimal impact on overall tax rates within CK. The area of largest impact on tax rates in the proposal was policing. The proposal noted that urban residents in CK are subsidizing the rural areas in policing, and it has been this way since amalgamation in 1998. I'm not convinced this is well known throughout the municipality. The arrangement is not a demonstration of open and transparent government. The Chatham-Kent Police Service provides consistent and uniform service throughout CK. In view of this, there is an opportunity in this year's budget to set funds aside to perhaps re-examine and or implement the tax modernization proposal of November 2020. This will not only support relevant elements of CK Plan 2035, but also ensure there is fairness across the board in the area charges. Thanks in advance to the Budget Committee, Council, and CK administration for using this opportunity to demonstrate strong and effective leadership in this year's challenging budget deliberations. Respectfully, Harry Bradley. And there's one more deputation that was submitted by Ann Coulter. Chatham-Kent Mayor and Council. My name is Ann Coulter, and since 1999, I've been maintaining the Walter Coulter Memorial Garden in the Maple Leaf Cemetery in Chatham. It is a large garden area filled with many varieties of plants, shrubs, and trees, as well as numerous memorial benches and rocks. A new accessible access will be added this summer. I have also established a Chatham-Kent Foundation designated fund to help maintain the garden in the coming years, and those funds should help. Last year, I was given help from some students who work for the municipality. What a difference that made. Normally, I and some friends do all the work, which, as we are all getting older, has become very difficult. I understand the seasonal worker for the cemetery is not being recommended on page 457 of the draft budget. The Maple Leaf Cemetery has become a very busy place, not only as a cemetery, but also as a place where numerous people come to walk their dogs, bike ride, come for lunch and coffee breaks, and as a place for meditation and religious services. As such, it increases the work of cemetery staff, ensuring it is maintained and garbage is removed, a difficult task for one worker. With the increase in activity, there is also a need for a washroom in the cemetery. Again, a much needed and used amenity. As one who works there and walks dogs there almost daily, I hope the washroom, which again is recommended to be cut, is funded on an ongoing basis. I know that residents want taxes kept low, but I also know that funds for these grassroots budget items are seen as essential, and the majority of residents would like to see these types of items not be cut. Sincerely, Ann Coulter. Thank you. There are no more deputations.
Thank you. Moving on from deputations, we'll get into the operating budget. And if you're looking at the business cases, those start at book page 103, or PDF page 105 if you're following electronically. Councillor Sakachi?
Through you, Mr. Chair, are we going just individual page by page right now? Is that how we're going to do it? This through? I'm just.
Thanks for the question, Mr. Budget Chair. So we'll be going division by division. So we will let council know what page to turn to. So if we go, sorry, I'm just, for example, the screen that's up now, legal services, they had one business case request, and that's what we'll be presenting. And we can always go down into the details if requested.
So can we just go basically start page to end page in this one, so it's a little easier to flip through? So, because I have a couple things open, is that okay? Because they're all over the place on this one here. So that starts on,
So we're working our way through
Correct.
the book right now.
so we have to wait for everyone to come individually before we put something forward? Is that how you'd like us to do it? Okay.
So, yeah, we'll kind of go by department. So we've got the legal services one, which is only one, but as we get down into a couple of the other ones, there'll be a longer list. So anything under these items? Seeing none, we'll move on to corporate initiatives. Which is page 107. Councillor Doyle?
Thank you, Speaker. Can I just ask a question about would it be page
Absolutely.
102?
Sure.
Just because I'm newer and don't know, there was a huge jump from 2022 to 2023 with regards to the operating related expenses. Could you just got clarification on why there is, on page 102? Unless I'm in the wrong spot.
That's the one in legal services? Okay.
Yeah.
Thanks, Mr. Budget Chair. So the significant increase in operating expenses is a direct result of the increase in insurance.
Thank you for that clarification.
It's a happy one. All right. So moving on, we're still on corporate initiatives, so that's up to page 107. And at any point, if you do have to go back, that's fine. We can entertain motions on any of these items later too, if it takes you a while to get there. Seeing none for corporate initiatives. Building services, which is book page 121. Seeing none, CAP. Oh, sorry, missed you. Councillor Doyle.
Thank you, Speaker. And just so for the Building Development Services, page 120, the page before, I wasn't here for this, but it looks like the licenses, permits, and fees, 2021 to 2022, there was a huge drop. Would you be able to explain what the drop was from?
Just to clarify, you're looking at page 120, and so we have the 20. Sorry, were you asking the change between the 2022 approved budget and the 2023 draft, or between
No.
the 2021 actual?
Actual for 2021 to approved budget for 2022. There's a huge drop, so I just wondered why we weren't bringing in the same licensing fees for that time.
Yeah, and Bruce, please add anything you want to say, but building department is a sort of a self-contained, by Bill 124, I guess it's what it's called, and where the fees that the building department charges for building permits has to stay within that area. So they had a good year in 2021. The actuals were far more than budget, but that gets transferred to reserve to cover when they have a poor year, if the economy dipped and there was very little permits happening. And then by regulation, every 5 years, those fees have to be looked at and reset either up or down, depending on what the previous 5 years were. The only changes in the budget between 22 and 23 is those two small lines that are listed on page 121 of the $1,600 and the $2,250 of additional fees that are being added.
Okay, yeah, thank you very much.
I wonder, can the treasurer comment on what we expect the actuals to be in 2022? Will they be close to what they were in 2021?
Just based on permit volumes, I would expect to be pretty close to the actuals of 2021, if not even a little better, somewhere around that neighborhood. So it was another good year from a revenue standpoint for building. Yeah. Mm-hmm.
Thank you very much.
Seeing no more questions, we'll move on to community attraction and promotion. Seeing no questions, we'll move, Councilor Pinsino?
Thank you, Mr. Chair. This non-union grade 6 project coordinator for 14 months, this is really hard to follow this binder, but is that all covered by a grant on page 132?
The workforce planning and research red grant. Okay, sorry, I was looking at the one before myself. Yes, it was covered by a grant through what the OMAFRA, what they call red funding, that we received for. It's an 8-month, I think, contract, or 18 months, sorry, position to assist with talent attraction and a number of other initiatives that we submitted for and received the grant funding approval.
So it's a contract position, and at the end, it's done, unless there's more money. Thank you.
So just a correction there, it was $3,047 short.
Okay.
Councilor Scotchy?
Thank you, Mr. Chair. I'd like to move that the $3,047 in one-time cost from the Business Case Workplace Planning and Research Grant be funded from the Strategic Development Reserve. I think it's page 132 on my internet, but it says 131 on the business case.
Seconder for that motion? Councilor Doyle? Any questions?
No comments either, Mr. Chair.
Councilor Crew?
I'm sure we're going to try and tackle some reserves. What do we have in that strategic reserve, Gord?
It's on your other sheet.
Oh, it's on the sheet.
So this obviously is a very small amount, and
Yeah.
I'm fine with this. I am going to get into that discussion about the strategic reserve and some of the funding that goes into it when we talk about the Chatham-Kent Health Alliance tomorrow.
Okay.
But I would, just in general, it's getting pretty emptied, and the reason why is because of both COVID and the Wheatley emergencies, we've had deficits for the last couple of years, and as reported to the last council meeting, we're going to have a deficit again for 2022 year end of about $7 million. So we've had no funds in years where we did have some surpluses. That's what we've used to top up that reserve and would provide that for things that happen throughout the year. That reserve is getting emptied with our discussions that we'll have with the hospital as well, and it's really not there are no large amounts of funds in there.
Okay, thank you. I will support it. I just wanted to know where we were at with that reserve.
Councilor Motti?
Thank you, Mr. Chair. In regards to the 18-month funding for the FTE, similar to Councilor Pinson's question, the contract ends does the employee actually leave the municipality typically? Because I just, often people will say, oh, well, somebody's funded for 18 months or 2 years, but does the employee actually typically leave?
Yeah, once a contract is ended, unless they manage to apply for another position that might be available, yeah, the employee would leave, but the job is done after the contract date. Yeah.
Okay, great. Simple question, but good answer. Thank you.
Any other questions related to this motion? Seeing none, I'll call the question.
Counselor Anderson? Thank you. All votes are in. Motion passes 16-0.
Any other items of interest under planning? Okay, we'll continue on to community health services, I believe is the next one. Starting at page 151. Any items of interest, Councillor Sakachi?
Thank you, Mr. Chair. Just had a quick question for clarity to Mr. Quinton. When you start talking about the reserves, is that, like, when you have that conversation, is that when we can bring up some concerns? Is that the best time to do it, when we're talking about some significant, I would say, challenges that we're gonna see in the reserves? Is that the time that we can speak on that, is when you start talking about it then?
Yeah, today we want to get through all the departments, but if tomorrow when we're at general motions, or if you have general questions tomorrow, that'd be a good time.
Councillor Pincinel?
Thank you. On page 152, the 4 early childhood employees, it's going into base, so, and I read this, am I assuming that base budget is coming from the federal government forever?
So yes, those 4 positions came to council last year, and that was through the Canada-wide Early Learning and Childcare. The amount of money that we got, we could hire positions in order to see that initiative through.
And that's annual money every year?
Yes.
Okay, thank you.
Councillor Story?
Thank you, Mr. Chair. On item page 150 on the electronic version, under the expenses social assistance line item, I know we're looking at 17 million, then 22, back down to 20. There's just I'm just curious as to what social assistance specifically means in this context, and what do we look at for the actuals this year? And do we anticipate that continuing to go up? Thank you. Thank you.
Thank you for that question. Actually, we're looking at that number going down. What that is childcare subsidies for families. And with the Canada-wide Early Learning and Childcare, we're down to, this year, 50% of the rates at childcare centers. So if a per diem was $40, starting in January, it would now be $20. So we'll have less people needing subsidy. And in the next 3 years, it will be down to $10 to $12 a day for families. So we anticipate that number coming down because of the other pocket of money.
Thank you.
Councillor Doyle?
Thank you, Mr. Speaker. Again, just because I wasn't here, material, so same page 150, material, vehicle and equipment related. 2021 was 1,147,000, and then we dropped to 60,000 and 69,000. Do you just know what the drop was for, and why was it so high in 2021?
I would have to, I'm not sure why that was so high in 2021. I know we increased staffing and we increased programs in 2019 with Early On Child and Family Center, and there was a lot of costs around the initial startup for that program. So that could be part of that funding, and once it's stabilized, that cost will go down after.
Thank you.
Counselor Anderson?
Yeah, thank you. I have a question about the employee-related costs. Are you experiencing vacancies, and is that to increase the number, the amount that you're paying employees, or is that to increase the amount of employees that we see the increase there? And also under contracted services, is that like food services? Is that like where would that come from?
So contracted services, we have had a consultant working with us. We had a special needs review because we fund our special needs resourcing agency. We've also had a consultant helping us. We've received money for workforce, 1.2 million to do workforce initiatives. So we've had someone working with us for that. We have had some vacancies, but we are looking to staff up. We currently have 2 positions posted, a financial analyst, and we had another case manager that was hired as well.
Great, thank you very much.
Any more items of interest or questions? Thank you. We'll move on to library services. And just a point of clarity, relating to the deputation, the waiving of the library fees is already a recommended item, so no one has to bring that forward. That's already in the budget. I don't see any hands, so we'll move on to employment and social services. That's page 177. Councillor Pinsonneau?
Thank you, Mr. Chair. This $1,906,000 for the homeless shelter, is that in base budget now?
Thank you, Mr. Budget Chair. We do have Polly Smith online, but this is not base. This is one-time funding that we are covering out of our economic downturn reserve in order to maintain our shelter and keep housing people temporarily while our team works with all of our landlords in getting people housed. So this is not base.
Okay, this has really escalated to where we originally started. I don't know. Thank you.
Councillor Sakachi?
Thank you, Mr. Chair. Just a question to Dr. Reedike. So April, I guess where I'm having a hard time here is we're funding money from a reserve for the emergency housing, but in the non-recommended item, we're not funding housing aspects. So I'm just trying to understand that a little bit better here, because it seems to be that the goal was when we first started, when I first started on council, was to provide sustainable housing and long-term housing. But now we're funding something at a reserve that at first we didn't really, weren't encouraged to do so in order to not fund something that's now not being recommended. Am I understanding that correctly, or is it just, maybe it's just how the accounting goes, but that's how I look at these two matters. I know separate, but to me they do go hand in hand.
Thank you, Mr. Budget Chair. Councillor Sakachi, it's a difficult question to answer. So certainly these are different, very different program areas. One is very operational in terms of maintaining our emergency housing and having people to staff the shelter and take care of very vulnerable citizens in our community. That is what's coming out of reserves, and that's the employment and social services item that's here. We will get to, and I'm not sure, certainly Gord or Steve can chime in when we get to the non-recommended items. I think certainly our housing services team will certainly have something to say about that for council in terms of really why we still think that that's a very important item, but we need to have that conversation with council on the council floor. And that item looks at inflation costs with respect to new builds. And certainly Ray will be able to speak to that point when we get to that place.
Is our emergency housing, is it currently full, and are we staffing it as it would to be full?
I will, that question, Mr. Budget Chair, I'd like to turn over to Polly. She's online. So Polly, if you can unmute and answer Councillor Sakachi's question, that'd be great.
Thank you, Mr. Chair. We are almost at capacity. The last I checked this afternoon, we had 3 spaces available in the emergency shelter at Victoria Park Place. We also do place some people in motel rooms. Tonight, we are supporting 66 people in emergency housing at this time. Yeah.
Thank you.
Councillor Hall?
Just a follow-up question to Dr. Retyke as well. You know, I understand the funding that's allotted for this year for the homeless shelter, but where are we at? You know, I know we're going to be getting into a multi-year budget here in next year or later this year. What's the timeline, I guess, for the shelter? Where are we at with that? I don't know if that's more of a open session. I don't know if that's a budget. But I'm just thinking, for 2024 or 2025, what are we looking at for the homeless shelter?
Thank you, Mr. Budget Chair. I'll start and maybe Polly might have some additional items to add. We will be bringing a report to council with our team's kind of plan or forecast to work at getting people housed and helping people secure and find life stabilization. What that means is the more people we can move from emergency housing into full permanent housing, the fewer people we have in emergency housing. We have that location only for 3 years total. So there are 2 years left at that location. And so I have asked Polly and the team to develop a plan to move out of that back to our kind of pre-COVID way of managing, working with our really vulnerable homeless individuals. Certainly, we need more housing. And I've said that time and time again. We need affordable housing. We need supportive housing. We need all kinds of housing. And until we have those housing needs met, we will be faced continuously with individuals who are not housed. So, we will bring that plan. We do, like I said, we've got a lease there. Only, there's 2 years and maybe a month left in that lease. So we do have some work ahead of us to answer that call for sure. So I don't know, Polly, if there's anything you want to add to that?
Thank you, Mr. Chair. The only thing I would want to add is that as mentioned, housing is key. We need additional housing. We will bring a model and an alternative model. We have had a lot of success with placing people each month, particularly with private landlords, despite really the odds being against us, with housing not being affordable and many people having low incomes. Despite that, we have had high success with placements and very low return to homelessness. So, but that can only take us so far. We need more housing, we need more supportive housing, and we need something else to turn the curve because new people fall into homelessness every day.
Thank you. Thank you. Councilor McGurl.
Thank you. My question is, you're asking for 16 new positions. Are these contract positions, knowing that, in 2025, our lease is up at the shelter and moving towards that different plan? So are these contract or will these become full-time in base budget?
Thank you, Mr. Budget Chair. These are individuals are working for us under contract, and I will let Polly offer a few more details in terms of who we have and what those numbers are. Because this is an item that we have asked for a couple years in a row, we always have to re-ask for those FTEs. Okay, Polly, anything to add to that?
Thank you, Mr. Chair. I would just add these are shelter leads and shelter support workers. These include part-time and casual positions for fill-ins. They're critical to the safe operation of the shelter, and they are all temporary positions.
Thank you. Any other questions related to these items in employment and social services? Councillor Sakachi?
Sorry, Mr. Budget Chair, I just have to ask one more. Maybe it's to April or maybe it's to Mr. Quinton. I guess just for like a population based around 100,000 people, is that a normal expenditure if somebody would be spending on an emergency housing around $2 million? Is that, because it's hard for me to quantify reading a budget, starting from where we originally started in my first year to now spending almost $2 million a year in reserves. Is that like a normal amount that a municipality of around 100,000 people would be supporting?
Thank you, Mr. Budget Chair. I'm going to actually ask Polly if she has any kind of thinking on that question. It's a great question.
Thank you, Mr. Chair. That is a great question, and that is in line with other municipalities. We regularly compare the per bed rate, and we are on the lower end of that from our comparisons with our colleagues, a number of our colleagues in the Southwest. So from our experiences, and we do speak at any given time with any one of the 47 municipalities in Ontario.
Thank you.
Yeah, and if I can add to that, Mr. Budget Chair, I think the challenge with doing it by population is, although we're starting to see unhoused people in rural areas, it's much more common in urban areas still. And so if you have a municipality that's primarily urban, it's going to change the calculation. But having said that, many millions of dollars are being spent on shelters across the province, more so in larger places like Hamilton, Toronto, Ottawa, places like that. So we can get you that information, but doing it on a per population basis is a challenge just because of the nature of the population.
Councillor Story?
Thank you, Mr. Chair. Perhaps Dr. Reed Dyke or Polly could comment. I think almost $2 million a year is an eye-popping amount, but I think it speaks to the severity of what we're facing in Chatham-Kent. And I think, reflecting on what Chief Khan said last week as well, there's so many other areas of our municipal budget where this comes into play. It's not just this budget line. So April, can you comment, sorry, Dr. Reed Dyke, could you please comment on different municipal departments which we don't see this direct line item, but are also deeply involved in this frontline work?
Thank you, Mr. Budget Chair. I'll start and then certainly Polly can chime in. I think as we navigate through COVID and the pandemic, come out on the other side of the pandemic, we have certainly seen a significant increase in individuals who have fallen into homelessness, who have difficulty navigating the system, who find themselves in precarious situations. What that has done is created an increase in multiple municipal departments, as you're indicating, Councillor Story. So not only within employment and social services, we have significant issues in our social housing units, both ours and some of our private nonprofits, of trying to navigate around helping people that are really hurting. And certainly I think Chief Khan said it well, there's an impact on our policing, on our emergency services. We look at some of our issues around mental health and addictions and drug overdoses. We could go on and on and on and talk for quite some time. What we want to see, and certainly if we can get more housing, specifically supportive housing, and I think that's key. Supportive housing provides wraparound services to assist keeping people housed. And once they kind of get all of the services wrapped around them, get the help that they need to be good tenants, we then help them graduate into a affordable housing unit or a social housing unit where then they free up space in that supportive housing kind of unit for somebody else to come in and receive those wraparound services that certainly assist. So, you know, if we look at EMS, if we look at policing, we look at fire, we look at all of our social services, all the portfolios within community human services, we look at the impact on our libraries even. It certainly is far-reaching. So, you know, the team is working really, really hard, and as Polly indicated, you know, lots of times we talk about the vulnerable citizens and some of the kind of things happening in our community when in reality every week they are housing more and more people. And every week we see success stories of people being housed, and those are the things we have to remember. That's what we're in the work to do, is to get people housed. So I don't know, Polly, if there's anything else to add, but thanks for the question, Councillor Story.
Yeah, thank you, Mr. Budget Chair. The only thing I'll add, I think April did a really good job identifying all the departments that are impacted. There are other departments impacted typically, like even operations in terms of how we, and I don't want to suggest that, you know, people who are unhoused necessarily are the cause of it, but you see increased graffiti, so parks, even just the equipment that we purchase, the assets that we purchase, we have to build them in such a way so that they can't be easily damaged. I know that our IES department has to think about that when they're building things like bridges and things like that. So there's many costs associated with it. It's a social challenge, and I can't think of many departments that aren't impacted really one way or another. So you're seeing $2 million here, but that's just one department. I think if you were to add up all the increased ambulance charges, all the increased capital costs, different increased costs in other operating departments, I think you'd see that it's a very big number. So supportive housing is not the ultimate solution, but it will help a lot, and it will be expensive. But I can suggest to you that for municipalities to be involved in supportive housing would be even more expensive because we don't have the capacity to do that. We have the capacity to build a house, but or build a building, but in order for us to ultimately provide the services that are provided in supportive housing, it'll be an additional cost as well. It might reduce some of these other costs we're talking about, but it's going to be an ongoing issue, and this isn't going to be the last year that we discuss. This is going to be here for quite some time, and we're not the only municipality dealing with it. It's just getting worse, and so it starts with housing, though. That's the key. So.
Thank you, Mr. CEO. I agree, and I share Councillor Sakachi's concern with those numbers, and I hope that in the future that line will be moved to another department, and we can help people further upstream, as opposed to the emergency situation we find ourselves in now. Thank you.
Councillor McGarrell.
Thank you. I just want to continue. We had a really good speaker at Roma, and it's all about supportive, but it's also about bringing them together. Because think about it as like you moving to a new place, a brand new place, and you're by yourself, right? And you're very vulnerable. It usually doesn't work, right? It works when you're there with your buddies, your family, your friends, and you do it together. So I think that's a big part of this. I also want to say I'd like the word attainable, so attainable housing instead of affordable, because then it covers all levels of housings that we need. With this, and it was a very big subject, obviously, at Roma, do you foresee, they didn't say too much to us, anything coming down the line funding-wise, or have you heard anything provincially or federally to help support, especially supportive housing? Because I now understand the need for supportive housing.
Thank you, Mr. Budget Chair. I personally have not heard any rumors out there. I don't know if our CAO has wants to comment. Certainly, we lobby and advocate pretty regularly for funding for housing, funding for social supports, and really doing all the things that you're speaking of. So I don't know. Michael, if there's anything you want to add to that from your contacts.
Thank you, Mr. Budget Chair. I agree. I mean, the advocacy is nonstop. OBCM, Ontario Big City Mayors, have made that one of their number one priorities. So has the Western Ontario Wardens, and I would suggest it's fairly new. In the last 3-4 years ago, those weren't the big issues. Now it's clearly the number one issues on pretty much all those advocacy groups. But there's no rumors about any funding. The good news, though, is that it's not just a provincial issue. As you know, it's a federal issue as well. And I find that usually when that many of the significant mayors or regional chairs get together, it may take a while, but usually they're successful at getting something. So I anticipate something will come down the line, but we don't have any answers at this point in time. But it's the number one issue. So I don't know how much more advocacy we can do. I think everybody gets it. They know it's, somebody used the word emergency. I think it was Councillor Story, or you're absolutely right. I think that's what everybody's calling it. So I'm hopeful we will get some funding, but we don't have any news to share with you at this point in time.
I'll just add on another quick comment, is that with the treasurers groups across Ontario, it's their number one issue, and going into the budget submissions that are happening right now for both the provincial and federal budgets, it's the number one ask, housing in general, for all aspects of it. So we hear rumors that there will be some announcements in the upcoming budgets, but until they come out, we don't know. So those will be in March.
Councillor Anderson?
Thank you, Mr. Chair. And I can appreciate this conversation, being had here, and I know that there's no easy answer by any means. Can you discuss some of the services that are in supportive housing, that are supplied?
Thank you, Mr. Budget Chair. Polly, I'm going to let you answer this question. You work with a number of our service groups that provide services in the community, and can probably do a very nice, succinct job of this question.
Thank you, Mr. Chair. There's a variety of services. The supportive housing that we're talking about today, referring to really, is quite healthcare related. So it could be assisting people with life skills. They're caring for themselves to a degree. They have to have some ability to be independent. They might have help taking their medicines, perhaps mental health counseling. There's making sure that they're getting proper meals. There's a variety of things. We provide there's a lot of groups in the community that provide sort of social work supports. But really what we're talking about are more in line with the healthcare related supports that often PSWs or nurses, RPNs would provide.
Thank you, Polly. I guess my only last comment on this would be, working in, what I do in my day and night job, is that, the best thing that we can do is to do some health promotion and addiction and trauma prevention. So I think that it's important that we, prevent these individuals from getting into situations where they are right down that rabbit hole. And I think it starts at a very young age. And I think that there's lots of work to be done in the addictions, mental health, and homelessness sector. And I'm happy to hear that, there's lots of lobbying going on at different levels of government, because it's definitely a Canada-wide issue. Thank you.
Councillor Pincinel?
Thanks, Mr. Chairman. I don't think anybody's arguing that you do need a homeless shelter, but I just want to make sure we don't end up with a Cadillac one, because honestly, that does draw people into our area. And you can't expect a small population to pay for that. We started out all good intentions with Riverview Gardens, but now we subsidize that millions of dollars a year, and we have the Cadillac of seniors home, and it says we got to have one, but we're envied by the bigger cities. Like, I just don't want to see this get, like, it's already, since COVID, when this all started, it's gone up 5 times in the amount of money we're spending. And somehow we just got to get a handle on it, and we don't have to be the best. We just have to have one. Thank you.
Any other, Councillor Story?
Thank you, Mr. Chair. Dr. Rita, could you, or Polly, I'm sure you visited other homeless shelters or perhaps have experience with this. Do we have a top-of-the-line Cadillac homeless shelter?
Thank you, Mr. Budget Chair. Polly, I will let you start this one, and I might add some things afterwards, but so I'll let you start.
Okay, thank you, Mr. Chair. The services and the facilities at the Victoria Park Place are quite basic in that they are providing basic needs. People are not attracted from other communities. This is a bit of a myth. And even if they were, there is a diversion process that we go through where we find out where people are from. It's very easy for us to verify, given that we also deliver other services and have records of people and where they've lived. And we look at, do they have other opportunities to stay with families or friends while we find them housing and while we work with them on housing? There's also, and people are very excited to leave, and they're thankful, but they're quite happy to leave us and have their own room or their own home. We do have that housing first philosophy in everything we do, and they're required to work on housing. The funding, we did receive a lot of social services relief fund in the last few years. That really helped us with that, and that ended in December. So that's, part of the change in funding requirements.
I don't have anything to add to that answer, Mr. Budget Chair. So.
I share Councillor Pinsonneau's concern about keeping costs in line, but I also think that we should encourage our most vulnerable populations, including our homeless, people experiencing homelessness and our seniors. They should be able to live in dignity. Thank you.
Councillor Crew?
Just very quickly, I've been on a tour of Victoria Park Place. Not a Cadillac, bricks, mortar, old school. That's it. Some beds. It's not a Cadillac.
Thank you. We have other lines in the budget that mention provincial downloading. And when I look at this cost, individuals who are on ODSP or OW are legislated into poverty. And until someone does something to address that, we're going to continue to see these costs escalate. So when we're so far below the poverty level for ODSP and OW, these are the costs that we're going to bear. And I think it was Councillor Solomon that always said there's only one taxpayer. So when you don't support people, this is the outcome. Any other questions related to employment and social services? Seeing none, we'll move on to page 186, which is housing. Any questions, items of interest? Councillor Hall?
Just to clarify, we're not doing if we have something from this division that we want that's not recommended, we're not doing that right now, right?
Not yet. We'll go as the last tab to items not recommended. Yep.
Thanks.
Seeing no hands, we'll move on to seniors, page 222. Hearing lots of flipping, but no hands just yet. Seeing no questions, we'll move on to arts and culture, page 235. Seeing no questions, we'll move on to human resources and organizational development. $243. Seeing no questions, we'll move to municipal governance, which is page 255. Seeing no questions, we'll move to financial services, which is page 270. Seeing no hands, we'll move to information technology and transformation, which is 277. And we'll keep moving pretty quickly, but if you do have an item you need to come back to, we'll still entertain those motions if you know, you're a little behind in getting through the book. The next item is ambulance, page 304. Seeing no questions, waste 325. Moving on to housing management, 345. Moving on to public works, page 353. Councillor Sakachi.
Thank you, Mr. Chair. I do have two motions here that are similar. Would you like me to put them as 1 and 2 or separate them completely? It's easier for the...
I think they could end up separated, so let's do them separately. Yeah.
Okay, I'll do the first one, that the business case, new 3-ton dump truck, Kent Center, be reduced by $33,266, one time in 2023, to take account for the timing of the delivery of the vehicle. If I could get a seconder.
Seconded by Councillor Crew.
Just a brief comment. When I initially talked to Mr. Brown about this quite some time, I guess when we first got our books, it was indicated that likely this is not, and I guess to clarify to Stephen, that this vehicle, although necessary, would not be coming in likely in this year anyways. Is that correct, Ryan?
Thank you, Mr. Budget Chair. It's very unlikely we will receive this vehicle this year. It could happen if the tenders came in and one's on the lot, but most likely not.
And if it did happen, would you bring that back to council to address that ask, or would it come from a different area? I'm just trying to understand accounting, if it does come in this year, how that would work.
If it was, we would have to identify that in the financials of the tender award.
Yeah, so just hopefully, have council support on this one. I'll be making a similar motion right after this one as well.
Maybe just for my benefit, Mr. Brown, would we be ordering it this year if it wasn't approved in the budget? So we wouldn't know whether it's going to come in 2023 if we don't have approval to order it this year.
So, thank you, Mr. Budget Chair. The ask is the one-time funding for the purchase of the truck, and then the number the councilor stated is for the operating life cycle. So if it's just to remove the operating life cycle in 23 off, we would still be able to go ahead and make the purchase of the truck and bring back the tender award. It's just there wouldn't be money in the budget for fuel for that truck or life cycle for that truck for this year. But as long as the other portion of that ask is approved, the one-time ask, we'd be able to go ahead and purchase the truck in 23.
But, sorry if I can, but if we're not sure it's even going to be delivered in 2023, because of the delivery time, wouldn't we be better off putting it off until 2024 or get pre-approval at the end of 2023 so that's not on this year's budget?
Thank you. I understand the question now. If we don't get the one-time ask in the budget this year, I'd almost have to have pre-approval to purchase that truck in 24 because once I would have to bring a report in 23 asking council to commit the couple $100,000 it is to purchase the truck, and they'd have to commit, but the actual price tag wouldn't be paid until 24. But when that council report came back, it would be committing council to a 24 budget number.
Councilor Scotchy.
Just to clarify, I guess by me saying it not coming in is basically how I understood it was the $33,000 was operating costs. And if there's not a truck there to operate, basically we would be removing that, reduce that from the one-time account, one-time funding to take into account of the fact that it might not be here to even operate.
No, that is correct. Thank you, Mr. Budget Chair. And it's also the one, it's, I believe Mr. Dubin's question was actually about the payment of the capital cost for the truck may not also occur in 23, depending on when the truck is delivered.
Councilor McGarrell.
I think maybe a friendly amendment would be to this, let's take this off and then come back to council when, if it actually does happen in 2023, or come back in 2023 with the ask for the 2024.
Thank you, Mr. Budget Chair. So if we do that, the challenge with doing that is that if I go out and put out a tender for a truck that's going to come to the council floor, let's say in June, and then if once that tender's out, I'm going to ask council to approve it. You're going to approve it, and then you've already committed funds for 24's budget before we even start budget deliberations. So if that's the will of council, it can be done, but it leaves. I wouldn't do that for any other truck, for example, right? This is the ask. Can I buy this truck? And I think almost if we didn't approve it in this process, I would almost want to bring a council report to you in open session to approve it. It's I see the distinction that the money's not actually being spent, but if I'm mistaken, the money for the truck, is it coming from a reserve, the one-time cost?
Thank you, Mr. Chair. I wanted to add some other comments into here as well. The 3-ton truck here, and also the next motion where Councilor Scotchy is talking about the snowplow. These are both additions to the fleet that we have right now. So in the regular budget, in our life cycle budget, we have about replacing other snowplows that just are 3-ton trucks and there always is a delay. Fire truck sometimes is up to 2 years. Pickup truck might show up in a month, but there's always some delay, depending on the type of the truck and ordering. So since this is a request to this budget to say we're asking to increase the fleet by these 2 vehicles, we need the approval so that they can put that order in. Yes, we'll soon find out whether it's, once you place the order, whether delivery will be in 3 months, 6 months, or a year from now. But we won't know that until we put in the order, and Ryan doesn't have the authority to put in the order until you approve it in a budget, because the last thing you'd want him to do is put in an order and then wait for the 2024 budget for approval. well, what if you don't approve it in the 2024 budget? It's already ordered. So that's why we're doing it in this order. We're fine with this motion because likely it's going to be at least the latter part of the year before this truck or the next truck arrive. So putting aside money for fuel and operating expenses we're okay with this motion, but I wouldn't want to not get approval in this year's budget to order the vehicle.
Okay, so my only thought on this is that, we approve it right now, it doesn't come to 2024. Is this money now tagged for that truck? It does not get absorbed into a budget, so then, 2023, we've said, yes, go ahead and buy this, but, we absorbed it into our budget and we spend it somewhere else, and now we're just gonna, cause we said in 2023, yes, we'll buy this new vehicle, that we just kind of put it again in our next 2024 budget. I want this money tagged, and it not be absorbed into something else. Does that make sense?
Thank you, Mr. Budget Chair, for the question. Gord, could you confirm the $186,000 one-time ask? Is that being funded from a reserve?
Yes, but through the growth.
Thanks, Mr. Budget Chair. The one-time cost is being funded from assessment growth as part of our assessment growth policy, so it's being funded technically from the assessment growth reserve.
And so to answer the question, Councillor, I'll take direction from council, but if both these items are removed from the budget, I feel like I would have to bring a report back to open session to confirm that council's wish that I go and order this truck even without that money in my budget, which I'm happy to do. It's just if both these items, like basically this whole ask is removed from the budget process, I feel like I don't have that authority to go out and buy that truck.
Just make me feel good that this is tagged and this will not be absorbed into something else and won't come back in 2024 when we actually get it, but we don't really see it because we've already approved it, is my problem. Like, just.
So is the question, would the $33,000 come back next year for approval?
Not just the 33, the whole amount, the 186,366.
Right, so this motion doesn't remove that one-time amount?
No, I started with maybe we should take it all out, but I just want it confirmed that, no, this does not get absorbed into any kind of budget, and it is actually tagged and set aside, and will be there, the same monies will be there in whenever we purchase the vehicle.
Yeah, yes, we can commit that this money is going to be set aside in the fleet reserve to pay for this vehicle when it does arrive.
Yep, thank you.
Councillor Wright?
Thank you, Mr. Chair. I take it some of this 33,000, some of it's for the life cycle of the truck. Like, that's not all, like you said, operating costs and life cycle. How much of it would be life cycle of that 33,000?
Thank you, Mr. Budget Chair. I don't have that number specifically, but to use some generics, the life cycle on this truck's probably in the 12 to 14 year range. So at the initial purchase price of almost 200,000, probably at least half of that amount is life cycle, and then the rest is fuel and maintenance. And also remember, in the beginning years, the maintenance is basically nil, and then when you get to 14 years of life, the maintenance is much higher. So. But it's at least, almost a third or half of that is just life cycle put aside to purchase the truck again in 14 years' time.
So by taking this out this year, we'd have to extend the life cycle 1 year longer once we receive the truck.
I don't think so. If we don't take delivery of the truck this year, if we took delivery of the truck immediately, I'd agree with that. But in all likelihood, we may be waiting for this truck for 13 months.
So we're just prolonging the life cycle.
That's correct.
Yeah, thank you.
Councillor Anderson?
Thank you, Mr. Chair. So I just want, to clarify, this money is strictly saying, it's almost like it would be taken out anyways because you wouldn't have to spend it. Is that correct? Because we wouldn't have the truck. So taking this out is kind of just saying we wouldn't be spending it anyways. So friendly, let's just get rid of it, correct?
That's correct.
Okay, thank you.
Counselor Sakachi?
Thank you, Mr. Chair. Just to wrap it up, I didn't mean to go down the rabbit hole, so to speak, on this one. I just want to clarify for everybody, just to ensure that I'm understanding this correctly, Gord. I was not hopeful to take anything out of, from the actual purchase because it's coming from a reserve and that would have no positive tax implications. My assumption of this item was insurance, gas, life cycle that we're identifying to this vehicle that's potentially not going to be in service. Ryan Brown does a great job, so I'm assuring if we get lucky and his truck comes in and you have to pull a few $1,000s from somewhere, you guys are pretty creative and can make something happen. So this isn't going to impact the purchasing of the vehicle. This is just going to potentially impact the operation of a vehicle that potentially won't even be in existence, which, just to clarify, is the same thing that I'll be bringing for the next motion, just to save some, some basic clarification purposes, right? So, yes.
Yeah, absolutely correct.
I don't see any other questions. I'll call the vote.
There was no friendly amendment on the floor, though, right? Is that correct?
No, just the motion that's on there.
All votes are in and motion passes 15-0.
Counselor Sakachi?
Thank you, Mr. Chair. I would like to also move that the business case new 6-ton snowplow Chatham be reduced by $70,525 one time in 2023 to take account the potential for timing of the delivery of the vehicle.
Seconded by Counselor Crew. Any questions? Seeing none, call the vote.
All votes are in, motion passes 15-0.
Any other items of interest for Public Works? Seeing none, we'll move on to Counselor Pinsino, sorry.
Thank you, Mr. Chairman. Page 354 and 355. So I take it that we're going to take another 100,000 and add to the budget for salt on 354. And then on 355, is that 62,500 that's being reduced?
Thank you, Mr. Budget Chair. So there's two separate lines for salt. One is part of the 5-year plan to make up for the reduction of a previous council that cut the salt budget. And the other line item for salt is actually due to the growth. So part of it is being funded from tax, a tax increase, and part of it is actually being funded from the assessment growth. So there is no tax impact on that.
So between these two, there's still a $38,000 difference, right? Or 37.5?
So there's 62,500, which is the first line, which is.
Is that being reduced?
No, that's it. That one is being increased to the salt budget, and it has a tax impact.
Okay, and 354, that 100,000 for due to infrastructure growth, that's being added to the budget as well?
So that's another $100,000 addition to the budget, but that is being funded from assessment growth because of the increased number of roads.
Okay, so that has no tax impact.
The 100,000 has no tax impact.
Okay, thank you.
Any other questions related to Public Works? Seeing none, we'll move to Parks, Recreation, and Cemeteries. That one's page 377. Seeing no questions, we'll move to engineering, which is page 389. Councilor McGrail?
Thank you. I did have a question, and it's in regards to keeping the ice in June and July. How did we make out with that this past, or summer, I guess it was? Because we kind of had a pilot program going there.
Thank you, Mr. Budget Chair. It's Rob Pollock, Director of Parks, Recreation, and Cemeteries. Thank you for the question. So it was approved to go through as a pilot, but we do have a minimum of 30 hours per week on average for the 8 weeks that it runs in June and July. We didn't make that. We had about 22 confirmed, so we didn't run it for this year. But for this, it's the same protocol again, so we need the 30-hour minimum on average for the 2 months for us to go ahead with it. If we don't get that, we wouldn't go ahead with it. And that's how we ran our numbers for the budget.
Okay, thank you.
Any other questions related to that item? Councilor Scotchy?
Thank you. So if that's not utilized, Rob, if let's say we don't go down there, so would that just be transferred to a reserve, or how would that work if it's not actually, if it doesn't meet the threshold?
Thank you, Mr. Budget Chair. So we actually gain just under $2,000 from it. So we would actually have a little bit less revenue coming in. So.
Okay, thank you very much. And will you be present when we go to speaking about the reserves as well, Rob? Do you know you're going to be present for that those conversations? When we bring up the reserves, is all staff going to be present for that in their department?
Yes, I did confirm. I will be there. Yeah. Thank you, Edward.
Any other questions? So still moving along into engineering. That was page 389. Seeing no questions, we'll move to non-departmental, which is page 395. Okay, seeing no questions, we'll move to the items not recommended. We'll go through in order. I think we had a number of these that had some interest. So I think the first one I got notice on was the affordable housing items. Oh, sorry, those start on page 435. Councilor Scotchy?
Thank you, Mr. Chair. Before we start going through the actual motions on this page, Mr. Chair, I'm just looking for some clarification from EMT or for maybe Mr. Dubin. So I'm looking at this not recommended, had a good opportunity to look through it for a large portion of the weekend. It was pretty exciting. But I'm just trying to understand the vetting process to this, because I'm just noticing on here, there was a motion from myself that was approved through my co-counselors. I noticed that Councillor McGregor has a study basically a rural infrastructure study on our gravel roads that was approved already. And there's a few things here that was strategic direction of council, for instance, affordable housing. And I'm just curious to see why some of these made the non-recommended list when they've come through the council process, the democratic process of being supported, and yet we're finding them on the not recommended page. And would be really curious to see how that vetting process worked and if council's previous direction was taken into consideration.
I'm going to start off, and then perhaps I'll turn it over to Mr. Dubin. So you're correct that for example, if I use affordable housing, we know that was the previous councils very high up on their strategic directions and priorities. And this council, of course, hasn't got to that point yet, but we expect housing, affordable housing to be making the top three of this council as well. So really, it was a philosophy of EMT to really say some of these decisions really aren't EMT decisions, they're council decisions. And so I think we chose perhaps a poor title of saying not recommended. It should have said not recommended, but also options for council that really become council decisions. So many of these are things that we know that council feels passionate about some of these issues. But we really think it should be a council decision to add it to the budget. I don't know, Michael, if you want to add anything to that?
Yeah, thank you, Mr. Budget Chair. I don't have a lot to add. I think it was just the exercise. I agree that maybe not calling it not recommended was the right term. It could have been, maybe consider in a better year. Could have been the title of the list as well. I think part of the challenge was that the inflation cost, and as we started going through the exercise, we're well over 11, 12% when we started this process, and we just couldn't bring that forward in an economic climate like we have. So, it certainly wasn't intended to slight anybody. Some of these things we really felt the council needed to decide, even though they're council priorities. Do you really want to do that now? Those are decisions we felt the council needed to make as opposed to staff. The other thing, there are a lot of things, and we'll see this later as we go through our sort of strategic planning. There's a lot of things that we do spend money on that aren't necessarily in compliance with council priorities, and those are decisions that council made. We felt that some of these fit into that category, that if council wanted to go ahead and do it, then you direct us to do so. But we just didn't think that we could possibly accomplish all this and could bring forward a reasonable budget like we did. So hopefully that helps.
But yeah, thank you. But was there a vetting process that would say, is it just basically people looking through notices of motion or potential budget asks and just saying no? Because I guess maybe you've already answered the question when it says not recommended. To me, I just curious why, if it was supported by council, going through the democratic process as a vote, why then it would come as a not recommended option from EMT, who is doing their due diligence on this budget, when it is items that we have approved because of our constituents and something that they've asked us and is important to them. So I do respect and understand it's a very challenging budget. I've been very vocal about that, saying that staff has done a very good job. But I also understand, as mentioned, my co-councilors and Councilor McGregor, myself, other councilors that have motions that deal with some of these items that were supported and rather recently, that they've come up not recommended. And I'm just trying to, and I do understand where you're coming from, but if there's a vetting process on how that just gets discussed.
Yeah, thank you, Mr. Chair. And maybe this will help. So one of the things that we did as we went through the budget process is we looked at our expenses, and as you would expect, every single one, and we sort of categorized them, if I recall, 1, 2, 3, 4, and 5, with 1 and 2 being ones that we had to do by law. Such as a perfect example would be in long-term care. The government said that you had to hire some additional people for infection control. We can't bring that to council. We have to do that. We're required to do that. There are other things that we have to do, as you know. We have to be able to plow the snow at a certain level. There's certain standards in terms of roads. So what we found is when we went through those 1s and 2s, we were already well over, like I said, 8-9%. And so it was those things that weren't either legislatively required, or there were other things that were contractually required. So for instance, waste collection. We have a 5-year contract with somebody. We've already said that in the 3rd year, this is how much we're going to pay. So those also fell under category 1 and 2. And so when we calculated categories 1 and 2, we were already at a very high amount. So just to be clear, the ones that fell into this category, and as I agree that perhaps the title isn't the best title, and it's something new for us too. Well, definitely new for me, but even new for the EMT, because we're using a different sort of approach this year. So that's why. And I understand that not each of you were involved in those discussions, but had you been there, you would realize that we got to a point where if we just did our base required legislative contractual stuff to do, we would still be looking at a significant increase. So a lot of these just fell out for that reason. And we felt that it needed to come to council for council to decide. Because we can't decide on 1 and 2. No one can. We have to do those things. I guess technically you can say, no, we're going to ignore our responsibilities in a contract with somebody. I guess you could do that, but that's not something typically anyone would suggest. So that's where we found ourselves with very few, if any, items in number 3, that category that we even brought forward. So I hope that helps. I think if it was in a different year and we didn't have inflation at the rate we had, then you probably would have seen many of these things on our recommended budget too, because for your very reason that council's already expressed that some of these things are things they want to do. Our expectation is you'd have these discussions and either put some back in or consider maybe deferring them, because this is a challenging year. So that's where we're at. So hopefully that helps.
Yeah, just last follow-up question. So let's just give an example to the funding for the gravel road study. If it doesn't go back into this budget right now, it's obviously going to remain a not recommended item. How is that going to follow up in next year? Let's say that there's additional funds for maybe some real infrastructure. Like, is this going to be kept on the radar for, because although it's Councillor McGregor's motion, it is something that I hear on a very regular basis. So I'm just curious to see how this looks if it's not put back in the system. Is it something in 2024 or that we're going to, or 2023 that we're going to have to bring another motion forward again? I'm just really curious to see how it's going to go forward if it remains a not recommended after it was approved by council.
That's a little bit of a tough discussion, because we're getting into them being the previous council's notices of motion to bring to the 2023 budget. And so we may need new notices of motion to bring it to the 2024 budget, because
Actually, Gordon, you don't have to answer. You answered exactly how I was hoping you would answer, and you just basically reinstilled my point that I anticipate some of these having to come back on the floor, because if they don't, they're just going to go away. And I do hate to see an increase to the tax number, but these were obviously very important at the time. They're still important, and if we don't continue to support each other and each other's communities, they're just going to fall off the wayside. So I do appreciate your candid answer, though. Thank you.
If I can just supplementary to that, so I know that typically in June, we come to council and ask for direction in terms of the budget, and I know we did that this time. I would suggest that there's nothing preventing anyone from council saying, look, those items that didn't make it in 2023 and that were in this category, we'd like you to address them in 2024's budget. We'll do that. We'll take that direction from council. So that will solve the issue, which is that it won't be lost, that it will come back. If you direct us to deal with it in 2024, then we'll do that. So I think that's another way of making sure that those items come forward.
And could some of these items be included in like the year-end variance report? So when we start directing money, I mean, hopefully we have a year where it goes in the right direction for the first time in a while, but would those be items that would be eligible to direct, new assessment funding or a positive variance?
Thanks for the question. I'm thinking, really some of these are base budget decisions, right? And when you're talking about a one-time surplus, like I mentioned before tonight, our strategic reserves getting empty, so that'd be one recommendation to top it up so that you'd be able to make further decisions on one-time items in the following budget. We know we're not gonna have a surplus for 2022, so we're talking summer of 2024, whether we'll know whether this council has their first surplus or not. But many of these are base items that need permanent funding too, so it really, only time to look at them is in the budget process.
So we'll move on to any items of interest under these. Councillor Hall.
Thank you, Mr. Chair. Referring to the item that's on page 438, the affordable housing reserve. So I move that $130,020 be added to the budget for the increase in transfer to the affordable housing reserve.
Seconded by Councillor McGregor. Any comments or questions on the motion? You can start, Councillor Hall.
Yeah, thank you, Mr. Chair. Yeah, this budget line is obviously it's used. We've already had a bit of a discussion about affordable housing and the the necessity of it and how we need to keep addressing it. I know this specific line deals with affordable housing builds. In speaking with Ray Harper earlier today, I know this one really targets what this council's heard about already is both the Blenheim build and the Wallsburg Westcourt Boulevard housing development as well. So I know this, if this item isn't in the budget, it definitely will impact those or could delay those projects. But I just wonder if Mr. Harper, I think April, you said he's on the line. Just wonder if Mr. Harper might be able to comment on this item and how important it is to have in the budget.
Thank you, Mr. Budget Chair. Ray Harper, Director of Housing Services, and thank you, Councillor, for the question. So essentially, this is my housing services only base budget line to develop affordable housing. When we develop affordable housing in the communities throughout Chatham-Kent, they're usually a combination of funding, whether it's grant, provincial, federal, or reserve funding, but this is our only guaranteed funding to develop units. So essentially, the best way to describe this line is this line, if it isn't adjusted for inflation, cost of constructions have increased. And I cannot build partial units. So a good simple way of explaining this, if there's a $1 million base budget, and we typically build 5 units at 200,000. If the cost goes up to 225,000, we're not building 5 units, we're building 4. And then this problem would steadily grow worse. So the projects that are in development right now have utilized this funding, as well as the upcoming projects will use this base budget line.
Thank you for that, Mr. Harper. I think we've heard from staff already tonight about the importance of continuing to invest in affordable housing in our community. I think it's important to keep in the budget this year and not wait. We need to keep addressing that, and this is an opportunity to do so. Thank you.
Councillor Bondi, followed by Councillor Scotchy.
Thank you, Mr. Chair. 2 questions. First question, where does the reserve currently stand?
Ray, I'm not sure if you want to address this or any of this or not, but council, the previous council approved a build that's happening right now on McNaughton Ave, and then there's a second one that's in the works in the planning. So Ray can verify where it's at, but in the process for Blenheim. With those 2 builds, I believe if the reserve is emptied, and that the base money, there's a base of, I believe it's $1 million in the base budget a year going to the reserve though, and this was to add an additional 130,000 to that. So this money plus whatever federal provincial grants that Ray can apply for is what will pay for the Wallsburg build that's being talked about now. So to answer your question, the reserves drained once the current projects on the docket in Chatham and Blenheim are complete. Ray, I don't know if you have anything else to add.
Budget Chair, yeah, Gord is correct. So I don't have the exact reserve balance right now, but this reserve will be drained on the affordable housing.
Oopsie.
I didn't get that, but.
I just heard drained.
I think he just said that they are drained with the, he repeated what I said, that the current reserve is gonna be drained with the Chatham and Blenheim builds that are ongoing right now.
Okay.
So there's nothing in reserve to fund this from the housing
So
reserve.
why wouldn't we just say this is to complete the builds? Like, the word reserve kind of confuses me. Sounds like it's going into a reserve, because it says reserve.
Yeah, the reason being, well, in April time too, if it takes 5 million, I'm pulling numbers out of the air here, but, so this is not actual numbers, but if it took $5 million to build the Wallaceburg building, we need to save up for 4 to 5 years before we can build it, unless there's other grants that come along. So yes, this money is being transferred to the reserve until it builds up to a value that Ray has enough dollars in that reserve to go do a build and bring her.
Oh, okay, that
Bring it
makes
tender
sense.
to
So,
council.
it's just, during this short conversation, it sounded like this money would be used like this fiscal year to complete a project. That's the way I understood it. That if they're short to, a little bit short on building, then the money would be used almost immediately. But no, it's not. This is gonna build over years.
Thank you, Mr. Budget Chair. So our housing reserves, and I'm explaining this as to how I understand it, which is very different than some of my other reserves, so I can only speak for the reserves that are within Community Human Services. We put money every year into a housing reserve. Some of that money comes from a tax base, and that's base funding that council has approved over a really significant length of time to increase that. We also receive funding at times from provincial money. We receive federal money. We put that into the reserve, and as Gord indicated, when we have enough money to do a build, then we put out the RFP and we award that RFP, and then we drain that reserve to do the actual build. So with the costs of inflation going up right now, what we've seen, and we've talked about that quite some time, and Ray summed that up beautifully. What would have cost us, or what money would have built 4 units, unless we stay current with the inflation costs for building these units, we're going to be able to build fewer and fewer and fewer units year over year over year. So we don't put money in this reserve, I want to say, to save for a rainy day. We put money in this reserve to hold it until we have enough to build a build. And that could be, right now they're working on the Blenheim one. They will be working on the Wallaceburg one, moving that forward. So does that help?
Yeah, it does. Sorry, the way I understood it incorrectly, I guess, was that ongoing projects would suffer if we didn't do this.
Well, and they might. If for some reason the costs for that Blenheim build, because of the increases, come in higher than what we, because of inflation, then this will assist with that as well. So there is
So it
some,
may be used immediately.
it may be in terms of stuff. We can see if Ray's back on, and he might be able to answer
I think
that better.
I kind of get it. Well, it seems it would be more of a priority if it was necessary immediately. Otherwise,
That might be.
maybe put it off this year because things are sort of tough, but this may have an immediate impact.
Yeah.
All right, well, that answers my question. Thank you.
Councillor Sakachi?
Thank you, Mr. Chair. And just to clarify for council, Mr. Quinton, there's still, the money is still going into the reserve. This is just directly related to the inflationary aspect and increasing the ask?
Correct. With inflation, that the previous council had a goal of getting up to, I believe it was $1 million in the base, or over the previous 2 councils. I think it took a long time to get up to that amount. But now there's less purchasing power than there used to be with that $1 million annually. So there's been this request for inflation for $130,000 to basically keep up to the same amount of units as
we could be for.
Sure, and just to clarify with you, Dr. Reedike, so, you know, I think that the past council and I anticipate this council will be very supportive of affordable housing. But if if your team, who obviously works very diligently, got into a situation where money, $130,000 was going to stop you from doing a build, you would definitely come to council and touch base with us with that. And I think that yourself and Mr. Harper have done a great job. I'm not going to support this because of the fact that it is an inflationary number. Inflation could change, but I would anticipate, and for me to answer my own question, if you were ever that short, you would come back to council indicating that you need some more funds. Is that accurate to say? Because I would support this if you're telling me no. If you say no to this, it's not going to go in there. But I wouldn't want this to start from a build. If that ever come up, your team would come and say, we need a little bit of more money. Is that correct?
Thank you, Mr. Budget Chair. For sure, we would, if we found ourselves in a situation where we had entered into any agreements in terms of building and the cost of inflation and things had increased to a point where we required additional funds, by all means, we would come to council before we would say reduce the number of units. Is that what I heard?
Yeah, I just wanted to make sure that if I didn't, you actually answered at the end very perfectly. I just didn't want to reduce the number of potential units that we're building. If it ever came to a situation, some provincial funding increased, or you come across, some land or municipal asset that can be utilized, I just know how diligent your team is that you would bring that forward and say, we got a potential here, council, can you support it? At that time, I fully support affordable housing. Just in this challenging climate of the budget, I would hope that if something comes up that you would revisit that, and not supporting it here definitely does not mean I won't support it if we have the opportunity to expand our inventory.
Councillor Thompson? Thank you very much. I think a lot of my questions have been answered. The one I was just trying to wrap my head around, and it falls in line with what Councillor Sakachi kind of opened with. I'm just trying to understand the conversation and the rationale that happened among staff to why this would end up on the not recommended list. There must have been some hard conversations there, and would help me make my decision if I knew what that was.
Thank you, Mr. Budget Chair. I think I will kind of paraphrase what our CAO, Mr. Dubin, said. When we went through all of our areas, and again, I can speak for Community Human Services and housing, we looked at the things within housing. Housing has a significant number of items that are mandated. They are provincially mandated. We have no choice, and we have to follow through with all of those items. This is one item where we have brought this to council. I think certainly, and Ray can speak to this as well. Part of the report that he brought to council in year was that we would be increasing the allocation to reserves through monitoring what the inflationary costs were, and we would increase accordingly. So this is one of those things. I agree with Mr. Dubin that we really felt we wanted to have the conversation at the council floor. It is something that council has already discussed and gave the okay for this, but this is not a legislated item. Hence, does that help, Councillor Thompson?
It does, yes. And just going through the timeline here, looking at page 437. In 2021, we moved this from $800,000 to $1 million, and then last year we moved it from 1 to 1.1. Is that correct?
Thank you, Mr. Budget Chair. That is correct. Yeah.
Okay, thank you.
Councillor Pinsino?
Thanks, Mr. Chairman. If we've totally depleted our reserve building these last two builds, we're not going to be building again for 3 or 4 years, likely. And we did diligently get this from up to 1.1 million up to this year. Basically, we're not going to build for 3 more years, and this being a high inflation year, I think we can skip this for a year and then look at it again next year. It's possible inflation will be down to 3% or 2%. But I just think this isn't necessary right now. You're not going to be building for at least 3 years by putting 1.1 million a year in, and that's a fair amount of money to put in. I don't think we need to put it in there. We're going the wrong direction. Thank you.
Councillor Story?
Thank you, Mr. Chair. I just want to say I'm finding this conversation very helpful. This is a challenging discussion, so I really appreciate everyone's comments. To build on Councillor Pinsonneau's statement, is this money that could be used in a leverage situation? If, for example, we had an opportunity where we would match with federal and provincial funding, would this be that money that would be applicable in those circumstances? So in the case of, I understand that if we were using it solely on paying for it ourselves, we would have to wait several years, in which case I think that makes sense. But I'm curious if that money would be available for other opportunities that came before the next 3 years, where we could build something with using this money along with other levels of government or private funding. Is that an option with this funding? Thank you.
Thank you, Mr. Budget Chair. I'm going to cross my fingers and hope Ray's back online, but I will start. Certainly, we do. We always are ready to receive federal funding. We're always ready to receive provincial funding, and then we have municipal contributions that go into it. Certainly, the government is always, or the larger kind of upper government levels, always want to see municipalities have some skin in the game in terms of building affordable housing. And then we often will apply, Ray, our Director of Housing Services, has been very successful receiving grants where looking at projects that are shovel ready help us to secure funding. But if Ray's back online, I'm not sure we've ever kind of looked at, we need this money in order to get a certain amount for our builds, but maybe Ray's is
Thank you, Budget Chair.
different.
If I could just jump in, I do have, sorry that I broke off there in my last response. A few comments to that. Yes, this funding actually is tied very strongly to our competitive grant funding applications, where we have to have a municipal contribution in order for us to be successful at our grants. So for example, if we didn't have this funding available to us, we would have not received the $5 million grant for the Rapid Housing Initiative build, because we had to put our own contribution in order to even apply for these grants. And in addition to that, Councillor Pinsonneau, we are building a new build in Blenheim this year. This spring, I will be bringing in an RFP to council for approval to build the 17 family units, and this funding will be used for that. This reserve is transfer to this reserve is very temporary in many cases. So this transfer goes to the reserve, and then I do a development, a housing development, and we use what funding is available, whether it's grants, provincial, federal, in combination with that. And I bring forward a recommendation to the council to approve the build utilizing all of those funding streams. So this reserve will be drained for this particular project this coming year.
Thank you. Just a quick follow-up. So that means this money, these funds are potentially already spoken for a project? If we don't have them, does that put the Blenheim project at risk? Am I not clear on that?
Thank you, Budget Chair. So this wouldn't potentially put the project at risk, but what this would do would delay the project funding or future projects because this funding hasn't been increased. So other upcoming projects would have to wait, such as the Wallaceburg project, while this project is been funded entirely.
Okay, thank you.
Any other questions related to this item? Councillor Sakachi?
Sorry, Mr. Chair, unfortunately, we lost Mr. Harper when I was speaking. So I guess, Mr. Harper, would this be a make or break for any project? That's, I guess, just a yes or no answer, because that would definitely, I'm full support of the Blenheim project. I thought that those funds were basically were identified already for use. And if I'm not correct, you can just correct me, please.
Yes, this funding could make or break potentially the next funding grant that we apply for if we don't have this funding available to us, because it's, like I said, it's a competitive process, and it will delay the upcoming Wallsburg development. In addition, I'd like to speak to the comments regarding inflation. We were very conservative with this budget line in terms of inflation being very sensitive to such a tough budget year. This actual increase to construction should be at 25%, not 12% that we've included here. We actually took 4 years of data to try to smooth out this ask to keep the ask quite low. So I just wanted to make sure that everyone is aware of that with regards to the inflationary piece.
Well, thanks for your comments. I guess it's going to alter the way that I decide on this topic. Thank you.
Councillor Pinsino?
Thanks, Mr. Chairman. So just to clarify, have we not started the Wallsburg and Blenheim projects yet?
So we have started the pre-design and cost developments in the walls. Thank you, Budget Chair. We have started the architectural design for the Blenheim in order to get the RFP process completed. Once that RFP process is completed for Blenheim, we are bringing to a report to council for council to review to award to a contractor to construct it with shovels in the ground this spring. As for the Wallsburg, the last report to council I brought, we were successful for our seed funding application. And right now we have a Let's Talk community engagement page. We're utilizing the seed funding that we received for our grant to develop a pre-design and cost estimate for that project. Once we have the pre-design and cost estimates, we can develop a financial plan in order for us to be better suited to go after any grants, especially considering we're going for a net zero build. So we need that information in order to align our funding resources and develop a solid financial plan.
So earlier on, you had said this would deplete the fund to do these two projects. So you're saying now there's not enough money to do the two projects?
Thank you, Budget Chair. So we will have the funding aligned for the Blenheim build. We do not currently have the funding aligned for the Wallaceburg project because we don't have the cost estimations yet. And that would be a much larger project over a greater length of time and certainly a very costly one. So we don't have those resources yet, but that's a further out project. We're in the pre-design and pre-development phase for the Wallaceburg project. But we do have the funding aligned for the affordable build, inclusive of this budget line that we're discussing today for this spring.
So this budget line has to go in there to get this project done. Is that correct?
This budget line, this increase here is not included, isn't necessary to get this Blenheim project built, but it will delay the Wallaceburg affordable housing development.
I don't understand how 130,000 is going to delay what's the cost of the one in Wallaceburg? 5 million or something?
I don't have any cost estimates for the Wallaceburg build right now.
So
due
after
to the pre-design and the seed, that phase hasn't been completed yet.
after Blenheim's built, how much money will be left in the reserve? You have that cost, right?
We haven't received, so thank you, Budget Chair. We haven't received, the RFP process hasn't completed, so we haven't received the bids for construction yet. We have our cost estimations.
All right, thank you.
So I don't have the final costs until I get the RFP process completed. And then I will have those costs brought forward to council this spring.
Councillor McGregor?
Thank you, and through the budget chair. I think you answered my question. What I was concerned about with if this is not back into our budget area, it's going to delay the Wallaceburg project. I think we've spent most of our evening talking about the need for housing and affordable housing within our communities, all of our communities. And I think that this is high priority. Gord, this amount, where'd I go? I switched pages here. $130,020. What's that translate into a budget? What, zero point what?
0.007 or 8?
Like in our overall budget and what we're talking about.
0.075?
But what, the overall amount in our budget when we're actually talking about, and this could actually delay a housing project in a community that is lacking and is struggling with housing situation, and would delay us off another year. And what does that mean? Do we keep them in an emergency shelter for another year? Or how do we afford to house them if we're not going to be proactive? We're all talking about supportive housing, affordable housing. You know, we're either doing it or we're not doing it, and I don't think that this minimal amount is going to do anything but delay another year starting forward on another project to help relieve our housing issues within our communities. So I'll leave it there. Thanks.
Thank you, Mr. Chair. I just got some additional comments. So this is adding 130,000 to the base. So throughout your term of council, that's 520,000. And in next year's budget, I'm not projecting what Ray and April are going to bring forward, but Ray's likely going to ask for an additional, like he just mentioned, that he took the 5-year average. He'll take the 5-year average again, and we'll be asking for another 130,000 that will add on this. So over the term of council, this really is about millions of dollars of funding for affordable housing, and can mean the difference of the Wallsburg project being delayed a full year because we don't have the funds in the bank yet.
And I guess that's kind of where I was going, because with this going forward and moving forward, it's not going to get any easier next year when it's either double or triple because of inflation rates or the change in rates, or because we're behind the 8 ball because we didn't stick with this, which we had previously approved already through reports that Ray brought, that were already approved with council at one point in time. So thank you.
Yeah, if I can, just supplementary. So I'm uncomfortable with using the words "will delay" the Wallaceburg project. No one really knows if the Wallaceburg project would be delayed. I think the point is that we're constantly building up a fund, right? We don't know exactly when the next build is going to come. We don't know exactly how much it's going to cost. If we don't continue to put money into it, then obviously it's going to take harder to build up that fund. So it could delay the Wallaceburg build. But if we were running behind, we always have the option of, I think it's Councillor Scotchy who said that, we also always have the option to come to council and say, look, we need a little bit more money. Do you want to wait until you put money into reserves next year, or do you want to contribute some money now? And that's a discussion we can always have in the future. So I'm not pushing back. I'm uncomfortable with saying that it will delay a project. It could delay a project. And as I think Councillor just said, McGregor, this is one of those things that's not going to go away. So at some point, we're going to have to put more money into this. And I think what Mr. Harper is saying is that we've been somewhat conservative in terms of what the inflation costs are. The reason why we didn't support this is because, well, if you actually look at it, we were trying to find a compromise, right? We adjusted it, which I think was good due diligence, to recognize that the construction cost was going to be more. And so we knew that amount. I think it was double this. And in order to, again, come forward with a decent budget, we decided to find a compromise and just do half of that, because we don't know what the future holds in terms of cost of living and construction costs. So I just wanted that to be clear. You're right, Councillor Pinsonneau, $130,000 isn't going to change anything at the end of the day. It's just going to put us a little bit behind the 8 ball over the next few years as we start putting more money into that fund. So I hope that helps. It does not mean that the senior team is not supportive of affordable housing. I would suggest to you that the fact that we even recognized that we needed to put more into the base because of the cost of construction is an indication that we do support affordable housing and put our minds to it. We just had to find some money somewhere to put forward to present a budget. So now it's council decision going forward.
Councillor Bondi.
Thank you, Mr. Chair. This has been a very confusing conversation for me. I could have swore I heard that perhaps Blenheim might be in jeopardy if this $130,000 didn't come through. Now I'm hearing Wallaceburg could be delayed if this $130,000 doesn't come through because it will be built on year after year after year. What this motion does is for this year. It's for $130,000. It's not for year after year. We can come back to this next year. And the thing that really I don't understand is this is a recommended to not do. But we're hearing, well, this is going to delay affordable housing in the municipality of Chatham-Kent. You know, the sky's falling, but yet it's recommended not to do it. So, you know, I'm hearing like both sides of this thing. This should be if this is what it is, and it could maybe jeopardize Blenheim and almost assuredly delay Wallaceburg at a whopping $130,000 this year. I wouldn't think it would be on the not recommended list to do, but it is, and now we're kind of going full circle. Like, this is where I find if people watching this on TV must think we're confused. I could think of different words, but in any event, I just think this has been kind of a mess of a conversation, but it was just a comment. Sorry, I apologize. I retract it.
Mayor Canna.
For a second, I want to set aside Wallaceburg and Blenheim projects, and let's look at the bigger picture, that the long-term solution to homelessness is building affordable units. And this money is going to go towards affordable units. Whether it goes to Blenheim, Wallaceburg, whether it goes to another one, we know we're going to have to spend more money than what we're spending now on affordable housing. We talked earlier about the $2 million that we're putting into a temporary shelter. We're saying that's huge amounts of money. The only way to not do that is to build affordable housing. So I look at this $130,000 is an investment in our community to ultimately spend less on homelessness because we've created affordable housing. So whether we put this in now or 3 months from now, April comes back and says we need more, we're going to need more money. So do we put it in the base budget, or do we start going in and saying, okay, 3 months from now, 6 months, we're going to start pulling a reserve and we're deal this. This is more strategic planning to say we're going to need this money. So I'm certainly going to support this $130,000 because this, to me, is our number one need in our community right now is affordable housing. And you know, $130,000. I don't know whether it's going to defer Wallaceburg or Blenheim, but we need to put it in there because it's going to be spent. We need to spend it as a municipality. Thank you.
Any more comments on this one? Seeing none, I'll call the vote.
All votes are in. Motion passes 10-6.
So we'll continue with the items. I won't call them not recommended because I think we've reviewed that title a few times. So the items on this page. So we're past item 2. So if anyone has interest in item 3 or 4, so that's the corporate internet service for municipal locations, year 2 of 5, or the Riverview Gardens Wi-Fi managed service, page 442. Councillor Story.
I'd like to discuss or move item number 4 to the floor.
So that's the Riverview Gardens Wi-Fi managed service to be added back to the budget. Seconded by Councillor Crew. Councillor Story, any comments?
Thank you, Mr. Chair. Yes, I think this is a relatively low amount to ensure that our only municipally operated long-term care facility is a modern one. If you've been in a long-term care home recently, you know that the staff there use mobile units to administer medication and care for the residents, and having reliable Wi-Fi is critical to the residents' safety. As someone who has had a loved one in long-term care for many years, including during the pandemic, having that connection via the internet to connect with them and communicate with them was critical. And these facilities continue to go in and out of outbreak, where that technology is absolutely critical to keep in touch with loved ones. So I support this in terms of caring for both our municipal staff and for our vulnerable loved ones in long-term care. And I would ask if Dr. Reetdijk has anything to add, but those are my 2 cents, and I appreciate your support. Thank you.
Thank you, Mr. Budget Chair. I will start, and then certainly Mr. Clinton can add anything from an IT perspective. This is a tough budget year. We understand that as EMT. I think when we look at Riverview Gardens, we do not have sufficient Wi-Fi, which impacts, and Councillor Story summed it up nicely, it impacts our staff being able to do their jobs as they navigate around a very, very large home. And it impacts our residents, and it also impacts any of our contracted services who come in and provide services at Riverview Gardens, and they do not have access to the internet. So once again, this is one of these things that while it is certainly not mandated that we do this, it certainly is something that is quite important to us. And certainly, Mr. Clinton, if you have anything to add from an IT perspective, I would also ask you to comment as well.
Thank you, Mr. Chair. And I do have James Sparks in the corner if there's any specific IT questions. But just to sum it up, the technology that has been installed over the years to provide the limited amount of Wi-Fi there is that was available just to staff to this point is at the total end of its life. It's failing and does not support what's needed in a modern facility. And but it wasn't mandated, so that's why it wasn't in the recommended list.
We've got a few more speakers. Councillor McGregor, followed by Councillor Anderson.
Thank you, and through the budget chair. It's extremely unfortunate that it's not mandated, considering that long-term care seems to be coming out of the words of the province on a regular basis, that this wouldn't be mandated, but that maybe goes to show of a larger city that already has all their high-speed internet in place, as opposed to our smaller areas that are still building to get our infrastructure in. To me, when I look at this, I read this, to me, it comes more across as a danger and a health and safety. We've got our nurses and our workers in there helping our residents that are in the building, and they're relying on dosing medications, they're filling out reports, and Lord forbid they have to either write it down and keep track, go back to the office, and then put it into the computer to update it. That's not even efficient use of time of our staff in the building for this amount of money that would take to increase and put the Wi-Fi back into the building, let alone the situations I know we had a situation with the nursing home in Wallaceburg, and where they had lost their internet due to actually lines going in. It got cut. Their service got cut for a period of time, and they were in utter panic as to they had staff going home to be able to use internet and internet services. So I can only imagine what it's like in one of our facilities of that size. And and I think of the people and even the compassion of listening to a story of one of my fellow councillors who lost a family member during the time of COVID, and there was no electronics and there was only minutes left on a phone to have a conversation, which could have so easily been remedied with proper internet and internet services when the facilities. It's kind of a no-brainer to me, and I don't understand why we would even put ourselves in that situation or at that risk. I definitely think it's a safety issue and a health and safety issue, and that it should be definitely back in the budget. So I commend Councillor Story for bringing it forward and adding it back to the list. Thank you.
Thank you. Councilor Anderson?
Thank you, Mr. Chair. My question is directly related to the cost that it would be to the residents that live there. Would it increase their monthly costs?
Thank you, Budget Chair. At this point, no. There's nothing in the works in terms of increasing costs to residents.
Do they currently pay for any phones that are in their rooms, like for a telephone service? Is that part of their?
I'm going to turn that to Mary Alice in terms of answering their phone system in terms of how our phones work. So we've got, it's quite innovative, really. So.
Thank you.
Okay, through Budget Chair. So the phones at Riverview Gardens, we do have our residents that have historically, we had Bell. They paid $25 a month for Bell service. Last year we switched over to CanQuest. So it's now the families sign up directly with CanQuest for that service. So that's what we're doing for phones. That's what we're doing for cable TV. Cable TV is through Cogeco. So internet, that would be something entirely separate. Then we would be looking at if we're getting internet service for folks and what that would look like.
Mayor Caniff?
Sorry, I just got kind of thrown off there. So to clarify on that, if we provide internet service, the residents won't pay for it at all? This will be a kind of a free service offered to them, just to confirm that.
Thank you, Mr. Budget Chair. At this time, the Wi-Fi in the system, and I will kind of look to Gord as well in terms of his comments in terms of whether we need to look at a fee for service or whether or not this Wi-Fi covers our whole building. So.
Okay, that was just clarification. Yeah. So certainly Councilor McGregor brings up a great point about safety and for those things. The other part of it is a quantitative aspect of saying if we don't do it, it says in the business case that there's inefficiencies. So it's costing us money, and I don't know whether you have a dollar value on that. When we put it in, we save money. Like that's why I want to get here. We're going to spend 38 grand on this, but I'd like to think there's going to be savings somewhere along the line that have not been factored in here. Either costs that we're going to avoid occurring, or we're going to save costs in overtime, or something like that.
Through the Budget Chair, I do have one example that I could give. One of the things that our dietary services would like us to explore is Bridge, which is right now all of our dietary services on paper. We have 320 residents, 3 meals a day, 3 snacks a day. Everything is printed on paper. And what they've said is that's in this day and age, we should be technical. So they would like to take us to a spot where we've got monitors, where everything is in a system, where if there's any meal changes, that it's done right in the computer, it's instantly done. The dietary staff can look at their iPads, they can see where the allergies are, they can see what texture issues people have. So the savings will be, there'll be paper, there'll be printing, there'll be ink, there'll be all those things that go, and the staffing piece as well of having to print all that paperwork. It's going to be instant in systems. So that's just one example. We're having Wi-Fi to connect to the iPads. We'll save money that way.
So will there be an effort to quantify that? Because right now we're approving 38,000 to go do that, but we're not going to get any of the benefits of the cost savings. So as part of the business case, I'd like to see that 38,000 of costs and say, oh, we're going to save $10,000 in paper and whatever it might be. The net is 28. So right now we're only getting the cost side of things. Is there any opportunity to put an offsetting savings in there? If there is going to be savings, I'll just toss that out to whoever will.
So another item, it's sort of related to that. This building was renovated into this seniors home in 2004, I believe, and so this became a early ask, so it made it to this year's budget. But if you remember, in last year's budget, council approved, I believe it was $100,000 to do a technology review of the entire building, because there's a lot of dated technology being used now. And through that process, there's a consultant on board now that's working through that. And through that process, we'll be identifying perhaps many things that will be in future budgets all about efficiencies, where that can pay bring a return. But they all required Wi-Fi, and that's why this became sort of the year ahead of those things coming. Whether we for sure could commit for next year's budget to see if there's actually is paper savings and those types of things to come through to offset any of the next year's ask. It just didn't come as part of this request with offsets, and it's on the fly here whether we're going to save $1,000 of paper or not. I couldn't tell you right now.
Yeah, paper is just a piece of it. I'd like to think there's other efficiencies, safety, that, because in the business case, it is very vague on all that. Because I'd like to see in the future, when we have business cases that say we're going to save money or it's going to cost us money, to quantify that moving forward, particularly for next year's budget. It helps us a lot more to make a business decision on this. And the business decision to me is overridden by the safety factor that Councilor McGregor brings up, to say if there's safety issues and things, that not having Wi-Fi, given that more and more of the equipment is reliant on that. The other piece is the province going to pay for any of this, or is this all municipal dime?
Thank you, Mr. Budget Chair. At this point, we do not have provincial funding for this. So that doesn't mean that won't come at some point, but right now this is a municipal building, and I think I will circle back around to Mr. Quentin's comments that this is an old building that requires all of the Wi-Fi to be, and Gord can speak better to that, or James as well, in terms of where we are in the state of the Wi-Fi in that building. So that's on us to maintain our building.
Okay, thank you.
Councilor McGarrell?
I'm good, thanks.
Any other questions? Oh, Councilor Bondi?
Thank you, Mr. Chair. Currently, there is Wi-Fi, though. It's just going to fail.
Thank you, Mr. Budget Chair. I don't know if Gord or James can speak to the Wi-Fi in the building and the state that it's in.
Yeah, it's really more like there is Wi-Fi. It's just like spotty and
Yeah.
Thank you, Budget Chair. Yes, to your point, it's at a point where it's at the end of life cycle. It could fail, and the chance of recovery, it may not be able to recover. So that's why we have this ask in for this.
Oh, yeah, sure. Oh, sometimes it was sounding like there wasn't Wi-Fi, but there is. It's just
yes,
not
there is.
good.
It's legacy, and it's kind of a best effort.
Okay, and just two real quick questions. Currently, well, it doesn't matter, but currently, well, I suppose it does. But if the new system's approved, currently, do residents have the ability to tap into this Wi-Fi, or is it just for staff? And if this system is implemented, residents would then be able to use this Wi-Fi? So my mother-in-law's there, and I know we pay for her internet. She's got a little modem thing going on, but.
So we haven't had any conversation yet on what it would look like for residents, but I think that if we had this approval, we would look at what can we do for our residents and what could we do at either low cost or no cost. We just haven't had those discussions yet. So one of the things that we're finding with our Wi-Fi is that it is spotty, that it is dropping calls. We do have family members saying, can we have our loved ones get on access? I think at the very least, whether we get this ask or not, we look at how to get Wi-Fi on first floor so that when families come in, they can access their Wi-Fi, they can bring their families in. And then if we do get this ask, we look at how can we expand it to 320 residents in our building so they all have access. We just don't have that capability now. We don't have enough nodes throughout the building that would allow us to have that kind of access or the strength. And again, I looked to James for that piece, but we don't have enough to get our residents on it. So right now it's only staff, it is not residents. But with this, we would look at residents. We haven't gotten that far yet though.
Okay, sure. Well, great. I'm sure they would all appreciate, they've got it all day, right? Spend on their phones. Another quick question, would the cost change annually? Because like Wi-Fi to me is modems. So would it be $38,000? Is that like the service fee? So it would be 38 year after year, or would 1 year, be equipment that would of course last for, a number of years?
I believe that this budget ask, thank you, Mr. Chair. I believe that this budget ask is just to replace the existing system. It's not to expand it onto other, for residents' use right now. And that would be, I believe, for a managed service, I believe that's a yearly ask for that.
Oh, so it's for service, right? So it would be third. Okay, that's great. That's everything. Thank you.
Thank you.
Councillor Sakachi?
So for Wi-Fi at Riverview Gardens, we're talking ballparking $40,000 a year. $38,000 a year for Wi-Fi. That's the ongoing cost. So you had mentioned that, I know it's not a one-time thing, but you mentioned that it was a strategic, that we went through basically an episode to look at efficiencies there from a data, whatever it was standpoint, right?
Yeah, I mentioned that in last year's budget, council approved for a technology review of everything in the building with the end goal of what new technologies are now available and that we could bring in that could bring about efficiencies.
So could there potentially be, I've heard, for one, first thing I'm going to do, I'd like to make a motion to call this not recommended, because all I've heard from administration so far is why we need all the things that are in this not recommended tab. So we've went from cutting down over $100,000 to now we're going to be increasing. So we're actually at the end of this session, we're going to be up around probably 0.016 ish in the area. So I guess what I'm wondering is if there's going to be efficiencies from this, can't we, for one time, take it from a strategic reserve, like the ITT strategic plan, and then see if there's efficiencies and calibrate it based on those efficiencies you may find by having Wi-Fi, maybe less overtime, less documentation, less paperwork, less moving the medication cart to a different building to find service. Is there a way that we could take a one-time cost associated with it? Because for one, it's an IT item, it's a strategic aspect, and then look at maybe the efficiencies and maybe the ask moving forward isn't $38,000, it's only 18 or 20.
I'll start and then maybe I'll turn it to April. This is signing a multi-year contract with the internet provider to provide managed service. So this isn't about, they won't, if we're just buying it for 1 year, then the price might be double this. But this will be like a 5-year contract, or however it's tendered out through IT, to be a managed service over a period of time. And they have gotten quotes up front to support this ask. Whether we could commit to future efficiencies in by 2024, that I'd have to pass to April and Mary Alice.
Thank you, Mr. Budget Chair. I think without knowing where we can certainly commit to looking for those efficiencies, I think that is the best way to talk about that. And it's hard to know where you find those efficiencies when you've had, I'm going to say, spotty Wi-Fi for so long that you get kind of lost in terms of, okay, if we have really good Wi-Fi and everything's working the way it should, are we able to, as Mary Alice has described, move all of our paper dietary records to being online? We haven't been able to do that because of the system that's in play right now. So that's one example, and we can certainly commit to kind of looking for those and finding those and seeing what is there. But when the Wi-Fi is really so outdated and at end of life, it's hard for me to say just exactly what each of those efficiencies will be, because we haven't had great Wi-Fi forever. So that's not helpful, I know, but that's the best that we can do in terms of that. And certainly, Mary Alice, if there's any other examples you can think of that we can really measure through the year, I'll let you speak if there's anything else you can think of.
Yeah, nothing else comes to mind just yet, but I think when you talk about the system and how old it is and that it's failing infrastructure, our ARNs, our RPNs, our PSWs all rely on Wi-Fi to use their medication carts, to do their documenting, to go into residents' rooms and do their treatments. If it was to fail, that would not put us in a good spot. So I think more than the efficiencies piece, I think that the fact that it is an old system weighs a little bit heavier for me, but certainly it is on the not recommended list, so it's up to the group on whether you want to put it back in.
Thank you. Councillor Doyle, followed by Councillor Anderson.
Thank you, Mr. Speaker. I think as a business case and a safety aspect, this makes perfect sense to do. My only ask, you had said that if this is approved and we get Wi-Fi for the building, then it might be at no cost or low cost to the residents. My only ask is that it's not at no cost, because my grandma's been in long-term care homes. We have to pay for the internet. Like Councillor Bondi said, they're paying for the internet in that residence. So I really don't think it's fair for taxpayers to split the bill for the residents of that place. So that would be my ask, if this is approved, that you do not make it free for the residents, and we can make up some of that 38,000 by charging the residents. And then it's, if we can save $5 or so $1,000 on the paper and the efficiencies, then we can make up the rest by charging the residents, would be my thought. Thank you.
Councillor Anderson?
Thank you, Mr. Chair. Just to clarify, is this just for operational for the staff, or is this planning to go to the residents as well?
Thank you, Mr. Budget Chair. Oh, you can, I will just start in terms of things. Certainly, if right now this is a staffing issue of replacing kind of what we have. If the Wi-Fi works out, that we can then bring that, as Mary Alice has indicated, to residents and families. For all the reasons Councillor Story certainly spoke about, then we will look at that. And whether that is at a low cost, whatever that works out to be, some of that we would bring to first our Committee of Management, and then probably back to Council as to what that looks like. But right now, this is really there to replace the system that is currently there. Does that help?
Yeah, it does. Thank you. I think that my point of clarification on that is that this may be a cost that is this amount this year, but could be decreased if it's then offered to residents and they're paying a monthly fee for it.
That's potentially a possibility. Another thing to consider, though, too, is that the capacity of the connection. Right now, we're looking at just the operational costs and needs for the staff at RVG. So that might be further discussion if we are going to open it up to residents, that they may have to have that discussion to see if capacity is there to allow residents to have an ample connection.
So this capacity that you're asking for right now would not support the 320 residents?
That is, I'm not going to say that it is or isn't, because this is where we want to have for a baseline to have RVG staff. It's hard to anticipate because we've had spotty internet for so long that when we have so many other projects coming online and some other other applications coming online, it might need that bandwidth.
Yeah, thank you. Just a comment to that. I completely support this. I think strictly from the operational costs, and this being something that is added to budget is a necessity. I think that a lot of, like Councillor Carmen said, I mean, you can get into a lot of medication errors. You can get into dietary errors. You can get into all sorts of things when you don't have the most congruent and updated, whether it's a physician's order or a dietary order. So I think just from the safety standpoint, to make sure that all those 320 residents are safe and getting the best care possible, this is an easy ask. Thank you.
Seeing no other questions, I'll call the question.
All votes are in. Motion passes 15-0.
So we're at 8:40, and we still have to move into closed session this evening. So we'll continue with this list at the next open session Budget Committee meeting, which will be tomorrow night. So I'll read out a motion that I'll then need a mover and seconder for it, that the Budget Committee move into a closed session meeting pursuant to Section 239 of the Municipal Act 2001, as amended for the following. Reasons: identifiable individuals, labor relations, employee negotiations, and advice that is subject to solicitor-client privilege in regard to 2023 labor contracts, net job evaluation changes, net progression increases per labor contracts. Before we move and second it and pass it, just an update, before we go into close, we are at 5.61. Do I have a mover and a seconder? Moved by Councillor Anderson, second by Councillor Crew. Any opposed? Seeing none, that's carried. We will take a 10-minute break and be back in here.